The Open Therapy Institute is addressing bias in mental health care. Go to our website, opentherapyinstitute.org. We have CE credit workshops about overlooked issues in the field. You can go to our workshop page and register now and become a member. And for those looking for a therapist, we match people with someone who's highly skilled and truly open. Just contact us through the contact page on the website or email us at info@opentherapyinstitute.org. I'm Leslie Elliott Boyce, and I'm speaking today with Dr. Andrew Hartz of the Open Therapy Institute, and this is the 22nd episode of our joint venture in this Open Therapy podcast, which has been really interesting. We've gone all kinds of interesting places, and this past weekend, Open Therapy Institute hosted a workshop on overlooked issues in men's mental health, and I thought that it brought up many interesting angles that have not really been adequately addressed or considered in, are certainly not in my counselor education. These were not things that we looked at. And I think they're really important because they're relevant to so many of us. And a couple of things that were particularly interesting that we talked about afterwards that were possible avenues for exploration came to my mind. And I just, perhaps I should let you say what you think and kind of.
No, we had 3 lectures on different issues related to men's mental health. It was therapeutic advice for working with men, anti-male aggression and bias, and the third talk, which was men who are falsely accused of sexual misconduct.
Mm-hmm.
So all of those things were explored, but it was just really clear, like we're really just scratching the surface.
Mm-hmm.
Men's issues are kind of like in some ways like worse. Like I got through my entire doctoral training without a lecture on religion and without a lecture on men's issues. And unlike religion, where there are these pockets of the field where faith-based counselors get training and there are programs that focus on that and there's some resources, they tend to only be used by the very observant. So people who don't see a faith-based counselor, their therapist probably might not have gotten any training at all on religious or faith-based issues. But with the men's issues, it's like there aren't even those pockets where it's like there are men's focused therapists that are therapy training programs that focus on men's mental health or anything like that. I don't know of anything like that. Maybe they exist somewhere. And I think one thing that wasn't really explored that's kind of like a meta issue, and then there are specific men's issues that are overlooked. But the meta issue is the field is becoming so feminized that it's really losing its ability to work with men at all. I think it's 70 to 80% of therapists are women. And, and of the men, they're disproportionately not heterosexual. Which could have relevance depending on what the issues are that the person might be seeking to explore. And I think that there's things even just about the way therapy is framed, that it has this tone and this structure that is just increasingly not working for men. The main thing that I think I hear from men is like, oh, this is a place where you just talk about your feelings. And what are your feelings and why do you have those feelings? And let's talk about feelings. And I think it feels like a lot of men, it's like, I don't really want to do this. And where is this going? And what's the point of this? And it doesn't necessarily feel so useful that they're not like, oh, I just want to go in and just talk to somebody about my feelings for a bit. So I think my way that I usually frame it for men is just like one way of framing these issues for men is basically to acknowledge that the human brain and the human nervous system has all of the human emotions built into it, anger, anxiety, stress, fatigue, desire, happy and sad, pleasure and pain, pride and shame. They're really hardwired into our brain and our hormones and our autonomic nervous system. and they evolved. Animals have them too. And the reason that we have them is because they serve functions. They give us information, they drive behavior, and they're useful if they're understood properly. They can give you connection and richness and inspiration and energy and drive and motivation and insight about yourself and about others. And people who are very successful, including, like, you don't think about a CEO necessarily this way, but a lot of what CEOs do is social work. They get people connecting, they get people motivated, they kind of chill people out when they have a problem, they get people motivated around something, and they deal with conflicts, they get people on the same page. A lot of the work of leaders in politics, in business, is social emotional.
Mhm.
And if men want to really be successful and thrive at anything that they're doing, like relationship, family, romantic stuff, dating, professionally, it's like that emotional piece is such a useful thing to have skill with. And your emotions, like, the other thing, I think there's this if you don't attend to that emotional side of the brain, it doesn't mean it's gone. It's still operating. You're just not attending to it.
Mhm.
And you're not getting the potential insights from it or responding appropriately to it. And you're not using it the way that you could to get connection and motivation and richness and that people can get. So I think when I work really with most of my patients, but especially with men, I really start with that fact. And then the benefit here is, like, this is a space where you can actually learn about what that is, that part of yourself, because then you can actually perform better and have more insight and more skill. And it's not just about crying about your feelings being hurt or talking about why it doesn't have to look like that. It's like you feel whatever you feel.
Mhm.
And that could be, it could be about sex, it could be about aggression, it could be about whatever you want.
Mhm.
But I think then it becomes about learning a skill that's going to help you thrive and succeed and be a leader. Like, you can't be a leader without good social emotional skills.
Mhm.
It's not going to happen. So, like, you can kind of say to young men, like, yeah, don't be a wuss and, like, cry about your feelings all the time. Fine, like, nobody wants to be around somebody who's constantly crying and whatever, but that's not really the point of therapy. It's to understand that process so that you can, like, improve how you're functioning and improve your
Mhm.
insights, and you get information from that part of your brain. Like, you get something about, like, why am I frustrated now? Why am I stressed out around this person? Or why am I, like, why do I like this or dislike this or whatever it is? And so just having that awareness is really, really helpful. And a lot of the things that people come into therapy for have to do with that. I think a lot of men's issues, some of these were talked about at the workshop, but I'd say these are stereotypes, so it's obviously not all men, but more it's like emotional numbing and an inability to engage with this stuff, which can really harm relationships and career and creativity and things that I think men do value. Um, Aggression and irritability, which I think every man has to figure out a way to, like, master and respond to that in a way that's assertive and constructive, and not destructive,
Mhm.
and also not passive or submissive, um, and loneliness and isolation, which is also related to the ability to connect to people and get out and build these relationships. So men can really benefit from understanding this part of themselves, and whatever their issue might be, it could be addiction, it could be depression, it could be a relationship problem, it could be aggression, it doesn't matter. It could be a sleep issue.
Mhm.
When you understand this part of yourself, it's such a valuable strength. And your therapy shouldn't be like, I don't know that I have any patients currently, or like it have in a long time, where it's like the session is like a crying session every time. Like, it's usually not. It's like, what are you thinking about? What is on your mind? What are you struggling with? And when you can access that emotional, motivational side of your psyche, it's a real asset. Uh, So I would just start by framing it that way. And then this is a place where you don't have to self-censor. You can talk about having like responses that are counterintuitive or contradictory or irrational or whatever they might be, and just talk through them and like to understand how to respond to things differently or better, or why you might be stuck on a pattern that's harmful to something that matters, your job, your relationships, your family. Um, and it can be very, very useful. The idea that it's like, oh, and how did that make you feel? And why do you feel this way? And maybe cry about it. And it's like, that's just sounds like bad therapy to me. It doesn't sound useful. And it sounds really cringy. And I think a lot of the stereotypes of like this, or if the therapist is just useless, like you come in, you talk about whatever you want, and the therapist just says, yes, tell me more, and they don't offer anything. Like I think it's best when it's an active collaboration where you're actually like reflecting about and talking about these things. Um, so I just think that there's things about the way it's framed. A lot of times, like when therapy towards men is framed in a way that's like very cringy to me. I think the outreach to men seems really, it would push me away from therapy to hear this. Like real men have the ability to cry, or like it's like, or to be vulnerable, or like it's stuff that actually like heightens the reasons why men don't want to go in. It's about talking about your emotions, is in a lot of ways it's about becoming less vulnerable. You're more aware of
Mhm.
what you feel and who you are, so you can be more assertive and stronger and more effective. It's not about making you weaker and weaker and more passive and crying more and vulnerable and like and so I think that and it's interesting because I think in the past, I think going back to the early days of psychotherapy, I think it was more of kind of like collaborative exploration about this side of stuff, or even like a goal focused, where we have a specific goal in mind that we want to understand, why is this happening? And so that's just kind of a general point. Maybe it's like a point about good therapy in general should be framed in this way, but there's a lot about how it's branded that I think like definitely alienates men, and it doesn't need to. Um, so, and I also don't think the other thing is I don't think everybody needs to be in therapy all the time. I don't think you need like endlessly ruminating about this stuff, but like you'll probably ruminate less if you have more insight, and
Mhm.
like like, oh, I'm upset about this, and what helps, like, and so I'll just like let it go. It's like little things, it's true, like little things in your life that aren't that important shouldn't derail you.
Mhm.
If they do, it's sometimes worth thinking about why you're getting so derailed by these little things. But like the big things weren't a response. And you can't like, and you do need to like respond when there's like major problems in your life,
Mhm.
speaking up, or whatever it is. So I think I see uh, men almost like internalizing um, like female models of emotionality that don't work for them. Where in order to like be emotional, they're like crying or talking about their feelings all the time, or like, or I guess maybe another model might be like with parenting, the way that like I think a lot of dads feel like they when they want to become involved parents, they become like maternal,
Mhm. Mhm.
because they don't really know how to be paternal, and there's not really a good model for like being a dad. So being involved parent means like being just like mom, and it's like that's doesn't feel comfortable to them. That's not who they are, but it's who they feel like they're supposed to be. And there's a way to be like emotional and assertive in a way that's masculine,
Mhm.
and like still engaged with feelings. And I feel like as the field loses touch with that, it actually like alienates men. Through not like through like imposing this model of emotionality that just doesn't fit who they are.
Mhm. Yeah, that's a really helpful framing, that sort of therapeutic tone as you see it, that would work better when working with men. And going back to something you said sort of early in the conversation, about how the therapy fields have become very feminized. It's really interesting to think about. I think as people, we all want the same things and are driven by the same things, but in different balances. Like we all have the same needs for connection and for to be admired and to be respected and to be thought of well and to have all the things that people want from each other in their relationships, but they do come in different balances. And you can stereotype men and women if you want, but in general, there are themes and ways in which things play out differently or manifest differently in men than women. And when a field does become so heavily dominated by one of the sexes, it is interesting how that sort of forces a particular worldview or point of view on everybody without a lot of respect for the innate differences in how these sorts of themes in life will manifest or be how we'll be receptive to them. I think I've been realizing more and more recently. The casual dismissal of masculinity or derogation of masculinity that you see right now. I can remember sort of my earliest experiences with that, like with friends who would just really kind of put men down and very easily make fun of men. Oh, men are just this or that. And it never really rang. It felt uncomfortable for me because I grew up with brothers and a dad that I really loved. And so this kind of casual male bashing, just it was in the culture, it was around, it was a thing that women do. I'm sure that the opposite is also true. There's these ways in
Yes.
which people can be very hostile and negative towards the opposite sexes. But when I started to hear that in graduate school and hear the sort of talking down about cis het white men, this is the group that you can really
Right,
put
right, right.
down. I don't think I really realized until more recently just the impact that that does have on individual men. When you are the only guy in a room or one of just a couple of guys in a room, and it's
Right.
really okay to hear your classmates and professors make fun of men and masculinity in these really easy offhand sorts of ways. And you think about like the psychology profession, who professions like applied psychology, counseling, et cetera, the people who are going to be drawn to that are going to be open, sensitive,
Right.
agreeable people, men or women. And to hear yourself be put in that category, it's kind of like I can say that it was hurtful to hear white people be put down while
Right.
I'm in the room. But for the men in those groups, it must do quite a number on them. And then to go out and work with your clients or patients, you're bringing some of that with you. And I don't know, that's sort of piggybacking off of what you were just saying about setting a particular therapeutic tone. Like, where does this come from, and what is it doing to the individuals who are being taught in this particular way?
Yeah. Well, that I feel like the anti-male aggression and the kind of demonization of men, it is there is a culture that's still there in universities and in training programs where you can just say like, I don't like men, men are trash, men are jerks.
Yeah.
Professors and instructors routinely say stuff like that.
Mhm.
And I do think it's damaging to have to sit through bigotry like that
Mhm.
and pretend that it's okay or that it's sophisticated or smart or acceptable in any way.
Mhm.
And it's because men are in this category of being a non-protected group.
Mhm.
There are these certain non-protected groups, and that basically means it's okay for people to hate you and express hostility towards you in
Mhm.
positions of power. And I think yeah, so I think that's really damaging. I think a lot of the way that most men like deal with that is to like hate the institution. It's a lot more, I think it's more like frustration. Like this is like so hypocritical that like, and it's the same people who are like, there's a microaggression related to women because you said you guys instead of
Mhm.
you all. That's unacceptable. They'll be in a rage about that turn of phrase. And then they'll just say men are all trash and I hate them. And
Mhm.
there's no awareness. So I think there's something about the hypocrisy of it that is particularly frustrating and particularly grating, and it discredits these institutions as being balanced or functional. They probably underestimate how much damage it does to them to
Mhm.
be so aggressive and hypocritical on these issues. Um, uh, but it's not. See, and I think my view is a man who's responding to this in a way that is attuned for him and is like actually like you could be like, this is outrageous
Hmm.
what's happening. And like I should say something. And how am I going to speak out in a way that is actually effective? Because if I go into a rage, I'm just confirming these stereotypes in their eyes. And it's an understandable response, I think, but it's not going to be effective and it's going to be high cost for you.
Hmm.
So how do you, talking about emotions, how do you use the understandable frustration that you feel about the hypocrisy in these systems to be assertive in a way that's effective?
Hmm.
You know, that's the conversation. That's a conversation about feelings,
Hmm.
technically. But it's like, but it's one that's actually more in a language that I think men could actually see
Hmm.
as more, rather than framing it as like, oh, that must have made you feel really sad and lonely. Where it's like, well, no, that's actually not what I felt. I felt mostly pissed off and I want to address it, but I don't know what to do because it seems like there's nothing to say to these people. And so I think like a lot of it has to do with like tone and vibe about how this is. There's this whole a lot of what therapy is has to do with this reflective process. The patient comes in, expresses something, and the therapist kind of reads that and reflects
Hmm.
something back. And
Hmm.
so like this is partly why I think like men might really prefer a male therapist and maybe if they're heterosexual, specifically a heterosexual
Hmm.
male therapist, because there's what's the mirror that's coming back to you? You know, and is it actually reflecting something that's helpful and accurate for you? Whereas like for me, I hear that and I kind of know like, yeah, that would probably be it's really hypocritical, it's really aggressive, and I get why that's frustrating and like what can we do about it?
Hmm.
That's what I would reflect back. And I think that there's a lot of very well-meaning female therapists who would reflect back that must be so hurtful for you.
Hmm.
Whereas I don't think that would land the same way. They'd be like, no, that's not really how I experience it. And you're almost like pushed to feel a vulnerability that doesn't feel useful to them or makes or heightens the sense
Hmm.
of like what they heightens like a non-helpful response that actually doesn't help them process it the way that feels right to them.
Hmm.
And I saw that all the time. Like I saw that with really some people, really talented female therapists. Some of them who I think were totally brilliant, but they would respond with just their mirroring was
Hmm.
just very feminine. And it
That's
was kind of
interesting.
like the type of the it's like the patient hits a note and then it bounces off the wall and it comes back as
Hmm.
like, what's the note that comes back? And I think like I would want to hear like, yeah, that's totally insane.
Hmm.
Like some reality, some like grounding in reality that this
Hmm.
is, yes, we live in a time where this type of like aggression and hypocrisy is tolerated and that's
Hmm.
nuts and it's not, and it's totally frustrating. And like, and then how do you respond? How do you respond to it? But I think I feel like that and it seeps into the literature and it seeps into the training when your supervisors are encouraging you to reflect back. No, tell them to like go deeper into their feelings of vulnerability about this
Hmm.
experience. It's like I think so. I think that's really
Hmm.
where the reflective process is goes awry. And even among a lot of male therapists, because they learn to be therapists in this environment, and then they kind of get attuned to like, you're special and like probably feel vulnerable, and that's okay here or something. It's okay. Like
Hmm.
I don't know. It's like this whole thing that's like, I wouldn't want a therapist to respond to me that way. And so yeah, I think a lot of that subtle piece of just like, and it's like it's hard to even articulate. I think exactly what that is about what where the mirroring goes off.
It's interesting. I wonder if at the risk of being too broad, if a part of the sort of, if we can use concepts like feminine and masculine, which, again, going back to the idea that everybody does want a lot of the same things, it's just in different balances. The feminine might be more oriented towards providing a sense of safety, while the masculine might be more oriented toward providing a sense of efficacy or like agency. So
Right.
more, I don't know if that sort of creating a safe space might appeal more to mm, more of a female typical emotional need for feeling safe. I mean, this, you look from an evolutionary perspective, and this would be the female being smaller, having the children, needing a sense of safety, versus the masculine needing to feel like they can provide and can do the things that they need to do in their lives. So I don't know if I'm drawing too big
No,
a
no. I
broad.
mean, yeah, I mean it's overly broad, but I think like there is like a probably like a general trend there that's
Mm,
accurate. Like um you know, I think like for a lot of men, being able to speak and
mhm,
articulate the issue effectively.
mhm,
It's like I felt like in couples work, you can kind of see like I do think like what I've observed personally, and I'm not sure how much data backs this up. My guess is it does, but um, there's a lot of the woman will have like just much higher social emotional intelligence
mhm,
and can just run circles around this guy.
mhm,
And like and especially when the guy has poor vocabulary
mhm,
around like he's just pissed off and he's like just stop doing that, it's annoying or whatever, and then or even worse like actually like snap, and then he's the bad guy and she can kind of know exactly what's going to provoke him, and then he's guilty and
mhm,
getting the power and like influencing through these different things, and then his needs aren't met. And so I just think lots of different like emotional dynamics like that
mhm,
that are probably fairly common where the man actually probably needs more help articulating what the problem is in an assertive, constructive way that allows him to be to solve problems and respond assertively, as
mhm,
opposed to, um, I think some approaches where it's like it doesn't address that imbalance and it just says, no, the problem is we've got to get the guy crying more and talking about how vulnerable he is.
mhm,
And it's
mhm,
like it's incredibly emasculating. And then when he doesn't want to do it, it's like, yeah, that's just what toxic men are like. They don't like to engage with emotion, but they're not really being helped to identify and articulate what they feel in a constructive way.
mhm,
And and that's I think probably a lot of the central issue.
mhm,
Even like with a like aggression, like it builds up at a certain point. It's like, and then there's like then they're really pissed off about it, and they it's like very, very helpful to like therapeutically in working with that issue, I think, to like slow it down and think like, hold on, what happened? Why was that frustrating? Like, what do you need right now? Even just like, I need to take 10 minutes. It's like, and the partner's okay with them like taking a 10-minute walk or something, being like,
mhm,
I'm really upset. We're not gonna have a constructive conversation. Just give me half an hour, you
mhm,
know?
mhm,
Like, it's just like stuff like that that can be like really, really effective. And then they can think about get a little bit grounded about what happened and like what the problem is and like frame it constructively
mhm,
where they can actually like be successful in that. It's like so much of men's issues, I think, are actually because they they don't they tend to not be as good at those skills.
mhm,
And I really worry about couples therapy in particular or family therapy where they're they're not, it's like sexist to uh for them to talk about a lot of the things that might be really important needs for them. Like, I don't want to be a second mom. I want to be a dad. And
mhm,
I do want to be involved. I don't want to be a bad person and like or be cruel or not be around my kids, but I don't want to be a second mom. I want to be have the opportunity to be an actual dad. And like that means being who I am with my kids. And I do love my kids, but I want to be with them the way that I am. And like, and the same in being a relationship. Like, I don't want to, we're not in a relationship between two women. Like I need to be able to be who I am. And there are things that men want and value and are important to them, but it's like, can they express that? Like I think
Mhm.
having a distinctive role that's valued, being able to express what they want. Some of that's about sex, what they want sexually, what they want interpersonally. And I think there's a lot of social taboos around what they can say they want and need around those that men feel really strongly about. And I think often don't communicate effectively about. And I wonder how often, I mean, the good couples therapist will do this. I don't know how often it is that the couples therapist is just totally blind to these dynamics. And the danger is that family therapy, couples therapy just become incredibly emasculating
Mhm.
because they totally invalidate all the things that the man feels the strongest about, all the things that are the biggest issues for him, and just kind of keep encouraging him to be more vulnerable or something in a
Mhm.
way that actually is not helpful. And then what's likely to happen is the man quits
Mhm.
and then is the bad guy for not wanting to continue. But he doesn't want to continue because the process is so antagonistic to
Mhm.
who he is and his personality and his needs. And so, but instead of that being reflected on the therapist, it's like it's reflected poorly on the man,
Mhm.
supposedly.
Mhm.
The therapy has to work for the male
Mhm.
in the couple, in a heterosexual couple. Like it has to work for him or
Mhm.
it's not going to work. And it's just shocking how little attention there is on this. It's
Mhm.
totally shocking. How can you do couples work without a really good sense of what actually works for men? And that probably means violating some taboos around gender and feminism and things like that to talk about what works with them. But I just don't see it happening that much in the field.
Mhm. Yeah, that's really interesting. It's a really, there's so much to talk about in this. Like, for instance, with regard to sex and relationships, what I saw in my training and what I hear from a lot of therapists is that the trainings that they're receiving are really kind of all about anything goes. So there's no promotion of the monogamous heterosexual relationship.
Mm.
There's kind of oh, it's not working for one of you. Well, have you considered polyamory? Have you considered opening
Right,
up your
right,
relationship to ethical non-monogamy? How about some
right,
BDSM? How about kink? Let's
right,
talk about
right.
this stuff. And so you've got this new strain in the therapy profession that's really promoting a breakdown of structure and really kind of working against both people's needs in this particular way, as far as I can see, both not just people, groups, men and women's needs in this regard. And um, I guess a bigger question that I have is sort of what this kind of comes back to a big question I've had for a long time is how do we make sense of sexual ethics and sexual morality in the modern era? I mean, we've got the therapy profession is both saying anything goes as long as it's LGBTQ and kink
Right.
friendly and all of these kinds of things. And you can't corner somebody into cis het monogamy. But also at the same time as we profess to have this sort of DEI LGBTQ morality that we're going
Right.
for, we're also saying don't impose your morality on the client. Just listen to them and help them to guide themselves. And you're supposed to be there to learn with them what they want and help them figure it out. Meanwhile, we have the DSM, which is basically a book of morals in a sense, because
Hmm.
these are the ways that you're screwing up the morals. Here's all the ways we're going to diagnose you because you're not falling in line. So it's like
Right.
it's like a reverse book of morality. So what is it anchored in, and how do you help a couple to find their way if there's no backdrop, if there's no solid foundation underneath of all of this? Do you have a sense of that? I might
Yeah,
not be
no, I
articulating
see
that very
what you're
well.
saying. I see what you're saying. I mean, I think with the DSM just has very muddled ideology. It's
Hmm.
tries to be non-ideological. Obviously, there is an implicit ideology in it. I
Hmm.
think the ideology implicit in it is really messy and
Yeah.
well, but without going into that can of worms. I mean, there is My concern is that people aren't thinking, they're not thinking clinically about sex.
Hmm.
Whatever the person's doing, just to think about this has meaning for the individual and for the
Hmm.
relationship.
Hmm.
And like that's the piece that it's like, because if you're just reflexively, oh, whatever you do is good, because it's like you're not thinking. I had, and maybe this has changed, but I had sex was another issue that I surprisingly like, and I trained at different analytic institutes in New York where there was no sex.
Hmm.
You know, there was no thought about what it means and what it does for people and the different conflicting feelings that people have about it and why. Um, and so it almost feels to me like it's the opposite. It's actually that the thinking about sex is really underdeveloped.
Hmm.
Um, people that people clearly have attachments and feelings about sex. Like, why isn't everybody going to sex clubs and doing polyamory and open relationships? Why not? I mean, you could say, oh, they've all just internalized the patriarchy or something. I don't think that's a very thoughtful response. There's something that doesn't feel good about too much casualness around sex. It can be very alienating to people. It can feel very isolating. It can be wounding. You can have all different types of complicated feelings about it that can lead to loss of connection with people, numbing. And in my experience, a lot of the people who have been most interested in that, like those types of movements, have a history with addiction or trauma.
Hmm.
I'm not saying everybody, but uh, this is anecdotal, but that's like there is something there. And I worry that when that people dissociate their attachment to people in order to do that stuff. They dissociate intimacy, they dissociate depth. You have to turn off part of the psyche. I mean, I get there is a part of our mind that like fantasizes about all kinds of sex and it lives in a fantasy space. It doesn't necessarily mean that you want it in reality because when it's real, you're going to feel other things about it that you might not expect.
Hmm.
Um, I was listening to like Bill Maher. I was talking about threesomes, and he's like, it's good for the ego, but it's not sexually gratifying. Like it's like
Hmm.
you're like, oh, you're with two women. I'm awesome. This is the best thing in the world. But it's actually like there's less intimacy, and it's like less gratifying because it's like, what are you doing? It's like you want to. I wonder how much of it is like this is Bill Maher, so I'm not, but it's almost like I want to see myself as a guy who's had a threesome,
Hmm.
and so I'm doing this to be able to like. It seems like it's almost more of this ego self-image thing more than it's actually gratifying, even though the fantasy could be there's all different types of fantasies that people have that are men and women that they're sometimes very uncomfortable with, that they have
Hmm.
fantasies that if they were to enact them, might not feel so good.
Right.
But I think like in people who really do get into a lot of that stuff, often they have to turn off feelings that they have. And sometimes they actively repress them. Like it's backwards for me to do that. I shouldn't feel attached to this. I
Hmm.
shouldn't feel hurt by this. I shouldn't feel lonely because of this. Um, and so they end up repressing feelings that they have about this stuff in order to fit a culture or something that they've
Hmm.
idealized for whatever reason. But I just don't see the stuff that's happening about sex that I see is like what you're saying. It's very ideologically driven. Everything should be okay. It should be, it's not really thinking clinically about what do people actually feel about it. What does it
Hmm.
actually mean for people? And like one of the meanings that I think sex often carries is it's about intimacy, and it's a way that you feel appreciated and valid, and that your needs are met, and that you're connected with somebody. And so when it doesn't happen in a relationship, people can have all different kinds of feelings about that. And it's not just about being sexually gratified. It has all
Hmm.
these other meanings wrapped into it. And I just worry that the field um, maybe doesn't think carefully enough about it in its in kind of going reflexively towards these particular ideologies.
Hmm. Hmm.
Um, but it's definitely important to men, and it's definitely important uh, to relationships. Um, and men and women might have different relationships to it, or different ways of kind of meeting halfway about it, or making sure that it works for them. Um,
Yeah.
yeah.
Well, and with that, like, how can we do a better job culturally talking about what men's needs are and setting up a paradigm of healthy masculinity in the modern era? I mean, we've certainly heard all about toxic masculinity. So what kind of conversations would be useful and helpful in promoting something positive for boys and men?
Yeah. Um, it's definitely worth. I see. I I thought that there. I think that it's my experience. Just this is, I guess, just like how I was exposed to ideas. Like there was kind of one camp that it's just sex. You shouldn't
Mhm.
have any feelings about it. It's just sex, whatever. Basically, there's no psychological complexity or depth to it. There's no real attachment or intimacy function. It's just sex, whatever. That was kind of one. And then the other side was like religious.
Mhm.
It was kind of like you shouldn't have sex outside of marriage because that's bad because it's contrary to religious teaching.
Mhm.
And what was kind of missing was like the psychology in the middle
Mhm.
of like people people have conflicted feelings about this.
Mhm.
What are those feelings? And I think something about feeling like attachment, feeling masculine, feeling connected, feeling authentic, those things often they they don't get addressed as much about, you know, how people can, you know, why do people, what are the conflicted feelings that people have? How do
Mhm.
they manage them? Why? How does that come into relationships? It's just kind of like, just like, let's just talk about it.
Mhm.
One of the things that I was like, that I've been interested in, especially with kids, is like, as like pornography use, especially among men, is like so normalized in society, people see a lot of pornography that's incredibly traumatizing.
Yeah.
And I don't, my patients never bring it up. Like
Mhm.
people don't talk about it, they don't
No.
think about it. It's
Yeah.
totally repressed. Does not mean it's not impacting them.
Right.
And like you can just easily go online and see totally crazy stuff.
All kinds of stuff.
And like to think like, oh, that doesn't impact me or that doesn't affect me. Or even just like young men, and it's like they're not having sex, but they're watching a lot of other people have sex.
Mhm.
It's like there's something that's like inherently like very lonely about that.
Mhm.
And um, so I think there's all different types of but just to recognize like there are things connected to sexuality like intimacy, attachment, connection. It can be a very deep personal thing that's really meaningful.
Mhm.
And but it's hard to sustain that, I think, in a culture that like can't, it's kind of stuck between like a kind of the reason why I don't like the religious arguments, and even though a spiritual person, is that they don't answer why. They just kind of
Mhm.
say, "Don't do this because religion says it's bad,"
Mhm.
and
Mhm.
that is a bad argument. Even if you're 100% right, that's not the way to make that argument. You need to actually explain why this has meaning to people and why how you think it should be practiced is going to be better for people. And
Mhm.
like you, and I feel like it often not without exception. I think there are people who do that, but um, that's a losing argument.
Mhm. Mhm. Yeah, it's sort of appealing to a primitive level of morality, like moral
Yes,
development, really, like thinking of Kohlberg's stages or something. Like because I said so.
because I said so. Yeah,
Mhm.
that's what
Mhm.
it is. And it's on the other side, it's not more sophisticated. Like there's not an understanding of
No.
like, okay, well, everybody's just repressed, and that's not what that's not. what you hear. Like people
Mhm.
try things and it's like, well, look, you've got there are dating apps. You can just like find people. Like you can
Mhm.
just have sex. Like I don't know. I mean, I'm not saying everybody can. I know that it's hard for a lot of people, but it's like you can just like find people and have as much sex as you want. And it's like people choose not to do that.
Mhm.
Why?
Mhm.
It's like because there's something about like we are animals that like attach through
Mhm.
sex and it
Mhm.
like me it matters to people. And when that's done in a I wonder about people who you have sex, you attach, then it ends really quickly. Then you have sex with somebody else, you attach, it ends really quickly. You've got to numb out part of yourself, and then you find a relationship that's meaningful. And I imagine that it's really hard to reestablish that
Yeah.
function.
Yeah.
Um, and but I just don't see. I just don't think there's this. I'm not dogmatic about any of this. Like it's
Mhm.
really like whatever. Like our job is to like help patients with their goals, and people have different values and personalities. And
Mhm.
but just to think clinically about what's
Mhm.
happening, and I just don't think we have a great understanding of it.
No, I think it's fantastic to just delve in and sort of explore these things because there is so much in the gray area. That's where most of the interesting psychological stuff is happening is in the area between these two extremes. And so it is always messy when you talk about it, but that's because, as you said, there's a lot of ambivalence in each person around a lot of these things. Few people are as rigid, I mean, on one side or the other in their thinking.
And it's interesting because okay, here's a thought related to going back to masculinity about sex. It's like I, one thing that I most again, anecdotally, I'm not sure about data on this. I should probably have read up before the podcast, but
Yeah.
but like, there are dominant submissive undertones or overtones in heteronormative sex, and it's overwhelmingly that the male is in the dominant position and the woman is in the submissive position, and that is not without meaning. I think to think about that the rest of the relationship can carry on as if that's not a reality. It's not true. There are things. The fact that people are attracted to that and that's what the sex life looks like, it shapes the relationship where to be in the dominant position, you're kind of like more of an identificatory person that's like identified with and like has to be more in control, more responsible and stronger. And then there's things that come with the submissive position too that are expectations and that's going to affect other parts of the relationship
Hmm.
where you have to if the sex is going to work and the romantic attachment that's built around the sex, there is like a um, there's a certain kind of implied role. And I don't, I'm not saying that it has to be totally all or nothing hierarchical or something like the whole relationship has to be this or everything's BDSM. And that's what I'm not saying that, but it's like, um, there is a sense that if you want to be attractive and you want to be consistent with what's working in this
Hmm.
relationship, there are certain responsibilities or like roles that the male needs to fulfill that are needed for both people
Hmm.
to be the one who's responsible or to be stronger or be able to be in control. And I think that psychological role is harder to fulfill than our society currently gives it credit. And there is this kind of like emotional psychological work that men do to be in that role that is
Hmm.
invisible because we can't acknowledge that this is like what we're attracted to sexually and something that serves this important role in relationships. And there's all these attempts to kind of like break down this role, and I don't think that necessarily works for people. So like and that's another place where a couples therapist kind of if in order for this relationship to work, I think you do need the roles that the couple gravitates to work
Hmm.
for them, not just emotionally and interpersonally, but also sexually, or
Mhm.
it's not going to work. And so, but I don't know that many. I can't think, maybe there are more than I think, like therapists who would feel comfortable sharing something like that with patients. It's like it's such a
Mhm.
social taboo to
Mhm.
even talk about this, but it's your couple's treatment isn't going to work unless it works on that dimension too. And it has a lot of like implications that I think people are uncomfortable with,
Yeah, and what's
including the
interesting,
couple. The couple can be
yeah,
uncomfortable with.
it seems like, one way that that gets expressed is through these caricatures of that dynamic that you're describing, like something like BDSM sort of kink stuff. That's a caricature of that thing that you're just describing. It's taking it
Right, right,
to its absurd conclusion when in fact in a balanced and happy relationship there would be subtle give and take that would flow throughout that dynamic, that would be like a position of say dominance would come with a careful assessment of the other person's feelings and needs. It wouldn't be just a like this cartoonish, I'm in charge. And a position of submission would come with a careful balance of knowing when to push, when to sort of resist something and when to give into something. It would be, and I'm not just talking about sexuality, I'm talking about
right,
relational.
right, right,
So
right.
there would be, if something's working well, it's because both parties are well attuned to each other and to the dynamic that they're creating, and I think that that is a really difficult thing to talk about because there's so much interpersonal difference in how the balances would be um, properly distributed, how that would feel for each individual person and each individual couple.
Yes, and you can't like I think that comes from like my sense of just repressing that this is like part of who we are as humans and part of who we are as men and women. You're going to get people who kind of get more and more towards extremes one way or the other. They're kind of more emasculated. They're afraid of being
Hmm.
in the masculine role. They're kind of
Hmm.
like maybe internally sexually repressed about what they want and what they desire, and they're more submissive and try to that they think it's unacceptable for them to feel this role that they might actually want.
Hmm.
And then people who kind of take the hyper cartoonish version of that role because there's like a discomfort with just like accepting it in a normal human
Hmm.
way, as like something that people are attracted to, and that's more balanced.
Right, right. And instead it becomes hyperbolic and fetishized and it's
Or
taken
repressed
or
or
repressed.
totally
Yeah.
repressed,
Yeah.
and it could very easily like have active be something that's very active in the man's sexual fantasies or pornography use, and then like not applied to the relationship because he's
Mm.
uncomfortable with expressing what he likes and or what he's
Hmm.
attracted to, and occupying a place
Hmm.
that's like more
Hmm.
of like, no, I do want to be the male, I do want to be in that role, that's what I am, and being able to accept that in a way that's more balanced.
Hmm. Yeah. That's really fascinating. And I, I feel like there's several things that I could talk to you more about. We need to
Yeah,
be
yeah.
mindful of time and not go into it too much, but just for future discussion, one of the things that you were talking about there has been something that I've thought is really impactful in a way that I don't think we really understand yet as a culture, but that pornography as the elephant in the room, as this thing that's being consumed on a really massive scale in
Right,
significant amounts, people consuming a lot of spending a lot of time on this, really engaging with it to an extent
right,
that wasn't even possible in the
right, right.
past due to what we have on the internet and how things have changed. And I I think that it's likely impacting relationships and individual mental health for men and women in really significant ways right now. And so I wonder if in the future you'd be interested in talking about that a little bit more.
Yeah, I'm interested. It is like a massive social trend that needs research and scholarship. I mean, all these things, I mean, this is why I feel like the Open Therapy Institute is so important, is like with a lot of these things, like we can kind of riff on it. And it is good to start the conversation on it, which is like I think a lot of what we do here. But it's like we need scholarship, we need data, we need studies, we need like I think that's um that's just missing on so many vital topics. So it's like, I think I am a little bit hesitant to like speculate too far and wide about
Hmm.
what this means for people. Um, but it's, it's, it's hard to imagine this stuff not impacting people. And, I mean, it clearly does. It clearly does impact people's behavior and people's sex lives. I mean, there's so much like more erectile dysfunction is like
Yeah,
one of the things that we do have as a data
right.
point. And I think about people who have these like very active sex lives where they want to have sex with lots of people, but they have erectile dysfunction.
Mm-hmm.
And it's like, I don't know. There's
Mm-hmm.
something like, what's this about really? Uh, Anyway, I think that's one, and it's like, and I think it also highlights, like, I know we talked more maybe about the sexual issue here with men, but like there's so many issues with men's mental health that like I
Mm-hmm.
think we should talk about more. Before we recorded, we were talking about like failure to launch and issues
Right.
with young men,
Yeah.
dating issues, um, difficulty dating, difficulty we obviously like there's family dynamic stuff. Um, I think there's just lots of one of the talks that we didn't talk about was accusations of sexual misconduct. And so I think there's just lots and lots of issues. Mental health really there probably needs to be something that's rebranded where men can get some of this knowledge and these skills in a way that works for them. And it might be something that's actually like a pretty different format than the one that we currently have. Maybe
Mm.
it's more Maybe it's more physical, maybe it's more group based where people talk about this stuff. Maybe it's just there might be a need to really rethink how we're doing it because I think men aren't getting really, really vital skills that they need in order if they want to succeed and lead and do what they want to do. Um, but it's worth thinking about the best way for them to get that.
Absolutely. I agree. I think that's really fascinating, and I think there's a lot more to be said. I agree with you about the need for scholarship. So I hope more people will feel like they can talk about these things because I think one of the reasons there's been such a dearth of scholarship is that there's been these taboos in academia around exploring some of these issues. So I hope that's starting to maybe break a little bit. And I know OTI is really trying to be a part of that. So I appreciate that very much.
For sure. Yeah.
All right. Well, thanks so much for a great discussion, Andrew.
Thanks, Leslie.
All right.